I finally convinced Eric to lie on his left side and let me examine his rectal area. And when I take a look, what do I see? A swollen purple lump that looks like a big, hard marble. I'm Dr. Robynne Chutkan, gastroenterologist, microbiome expert, and author, and I am here to help you find gut bliss. On today's show, I want to tell you about something that happened about 17 years ago. Our daughter, Sydney, was around 2, and she ended up coming down with a terrible case of diarrhea and vomiting, and she ended up in the hospital diagnosed with a severe rotavirus infection. My husband, Eric, had just left that morning for Guam, and this is a trip that takes around 24 hours from Washington, D.C. By the time he arrived in Guam, Sydney had been admitted to the pediatric unit at Georgetown Hospital with early signs of kidney failure and liver damage as a result of the severe dehydration that was caused by the rotavirus. When my husband heard the news, he did what most parents would do. He turned around and headed back to the airport to make the trip back from Guam to Washington, D.C. By the time he arrived at the hospital the next day, Sydney had been rehydrated with IV fluids, her labs were all trending back to normal, and she was sitting up in bed enjoying unlimited popsicles from the nurses, laughing and looking totally fine. Definitely not the death's door situation I had described to him on the phone the day before. But Sydney's hospitalization for rotavirus is not what I want to tell you about today. This episode is about something else entirely, and it involves my husband Eric's buttocks. Eric had been a little constipated before the trip to Guam because he had had a busy work schedule getting ready for the trip that had him off his usual exercise and healthy eating routine. During travel, he opted for what I like to call the camel approach of not drinking any liquids whatsoever to avoid having to get up from his window seat and sort of inconvenience his fellow passengers in the middle seat and the aisle to get to the bathroom. By the end of this 48-hour round trip of sitting on the airplane and dehydration, what started out as a slight discomfort in his rear end had blossomed into a stabbing, knife-like pain in the butt. The Gut Bliss podcast is brought to you by VisBiome, my first and quite frankly, my only choice for a probiotic. Whether you're dealing with irritable bowel syndrome or just looking to restore your gut health, VisBiome can help. It's a medical food for the dietary management of IBS and gut inflammation. Backed by science and clinically vetted by thousands of my own patients. Find your gut bliss with VisBiome. Go to visbiome.com/gutbliss and use discount code GUTBLISS at checkout. Once we got Sydney home from the hospital and stabilized, I began the even more challenging task of getting Eric to drop his pants so I could get to work checking out his rear end. And I will be perfectly honest. For me, looking at someone's butt is basically like looking at their elbow. There is no grossness or awkwardness or embarrassment associated with it on my part. But that is definitely not always a case for the person I'm examining, even when that person is my husband. So I finally convinced Eric, after literally like 3 days of chasing him around the house saying, "You must let me see what's going on. I am a board-certified gastroenterologist. I can help you." So I finally convinced Eric to lie down on his left side, which is how we typically examine people, and I take a look at his rectal area. And what do I see? A swollen purple lump that looks like a big, hard marble. What I am describing is a hemorrhoid. So let's start with some basic definitions. A hemorrhoid is an inflamed vein, and we all have veins in our rectal area. When the inflamed vein is in your lower rectum, we call it an internal hemorrhoid. And when it is one of the veins that's lower down in your anus, we call it an external hemorrhoid. When these veins get inflamed, they become engorged and swollen, and blood pools inside them because they're veins, so they normally have blood running through them. But the blood pools, and sometimes it can clot, and that can cause pain. It can cause bleeding. Hemorrhoids can be itchy. what causes these veins to become inflamed in the first place? Usually when there's additional pressure in the rectal area or something that weakens a lining of the rectum or the anus. The commonest cause of hemorrhoids by far is constipation, especially if you are someone who does not eat enough fiber to produce a nice, bulky stool that's easy to expel. And so we have seen a dramatic rise in hemorrhoids, for example, in people who are doing low-carb diets because they're eating tons of animal protein, usually high-fat, high-protein, and oftentimes, unfortunately, low fiber. So we've seen sort of an explosion in the amount of hemorrhoids that we're seeing as people have adopted these low-carb diets. Who else gets hemorrhoids? We can see hemorrhoids with pregnancy because of the increased pressure from the fetus on those veins from the lower extremities that end up in the rectal area. We can see hemorrhoids in people who are overweight or have obesity. We can see hemorrhoids in elderly folks because of the thinning of the lining of the rectum. Prolonged sitting, especially sitting on the toilet. And check out episode 2 of the podcast on shy bowel for more on that. It's literally one of my favorite episodes. So prolonged sitting on the toilet, prolonged sitting on an airplane, like what Eric had to do going to and from Guam, those are also common causes of hemorrhoids. And you can actually get hemorrhoids from the opposite problem of constipation. If you have persistent diarrhea where you are having bowel movements over and over and the veins become irritated and inflamed because of all the stool that's constantly passing through the area. Hemorrhoids can sometimes be asymptomatic. Your doctor may see them on a rectal exam, but most people do have symptoms. And the symptoms are generally small amounts of bright red blood in the stool or on the toilet paper, or anal discomfort or pain or itching, and sometimes stool can leak into your underwear. Chronic hemorrhoids can actually cause anemia because even if you are just losing a tiny amount of blood over a long period of time, that can add up. It's like a pipe that is dripping, and over time you can end up losing a lot of water that way. So you can lose a lot of blood if your hemorrhoid is just bleeding a little bit every day. But why was Eric experiencing so much pain from his hemorrhoid? It's because he had what's called a thrombosed hemorrhoid, where the vein doesn't just become irritated and inflamed, it becomes engorged and swollen, and the blood inside forms a clot that hardens. And anytime you sit or walk or move or have a bowel movement or put any pressure on the area, it can be super painful if you have a thrombosed hemorrhoid. And it can be sort of an emergency because there are actually things we can do surgically to help treat a thrombosed hemorrhoid. Within the first couple days of it forming, we can make a little incision in the hemorrhoid, and then we can pull the clot out through that incision and allow the area to heal. But that has to be done within the first typically 72 hours of the hemorrhoid thrombosing. And in Eric's case, it had already been several days. So it was really too late to think about incision and drainage. When we come back, more treatment options to get relief from hemorrhoids. Okay, so we've talked about incision and drainage for an acutely painful thrombosed hemorrhoid. But what else can you do to alleviate pain from a hemorrhoid, maybe one that's not thrombosed? Well, the first thing is to try and relieve the pressure on the vein. And so I'll usually recommend a donut-shaped cushion to sit on. So it's a circular cushion, but with the center cut out so that when you're sitting on it, there's no pressure on your rectum. Sitz baths, which involve soaking your bottom in lukewarm water with unscented Epsom salts, can also be really helpful for softening up that clot inside the hemorrhoid and helping it to dissolve. But there are a couple things I want you to keep in mind here. Number one, make sure that those Epsom salts are unscented. This is not the time for fancy lavender bath salts. Those are going to irritate your hemorrhoids even more. The second thing to keep in mind is that just sitting in a bathtub is not that helpful because when you're sitting in the tub, you're actually putting pressure on the rectal area. So you want to go out and get a little plastic tub, the sitz bath, that fits inside the toilet. You lift up the toilet seat and you put that little plastic tub in the toilet and you fill it with water and the Epsom salts. And then you put the seat down and you sit on the toilet, and that allows your bottom to soak in the little plastic basin. So that way you have at least a couple inches of water between your rectum and the bottom of the basin, and there's no pressure directly on your hemorrhoids the way there would be if you were sitting in a bathtub. So this is a fantastic $10 or $20 investment to get that little plastic basin that can fit inside the toilet bowl. Critically important, if you have hemorrhoids, is you want to make sure that your stool is soft so that when you're pushing it out, you are not further inflaming those veins. I will often recommend a stool softener plus a little magnesium at night, lots of water, at least half your body weight in ounces of water, a fiber supplement like psyllium husk in the morning to keep things soft and moving. So I will often recommend the kitchen sink, literally, to make sure that the person's hemorrhoid is not going to get irritated. You do not want to be straining to push out a hard stool because that is going to put more pressure on that inflamed vein, and it's going to make your hemorrhoid bigger and more painful. So the goal here is soft, easy to pass stool. And again, water, fiber, magnesium, these are all things that can really help. I mentioned incision and drainage for an acutely thrombosed hemorrhoid, and that's something that a colorectal surgeon or a general surgeon does. But there are also things that we do as gastroenterologists for chronic hemorrhoids, which can also be very helpful. And one of those things is banding. This is a procedure that's usually done at the time of a colonoscopy. So we attach a little device to the end of the colonoscope, and that device sucks the hemorrhoid in. And then a band, literally a rubber band, is released, and it goes around the neck of the hemorrhoid, and it basically strangles it. It cuts off the blood supply. So your hemorrhoid eventually withers up. Now, this can be really effective for hemorrhoids that are bleeding chronically. But you would never want to band an acutely thrombosed hemorrhoid because that has a clot in it, and it would be very painful if you did that. And the thing that I always want to emphasize, if you have considered getting your hemorrhoids banded or if that has been offered to you, is that you must address the root cause of why you have the hemorrhoids in the first place. Usually constipation or hard stool, because even if the banding is super successful, your hemorrhoids are eventually going to come back if you don't address the underlying cause behind why you have them in the first place and commit to solving that problem. So even if you're having a procedure like banding that is going to take care of the problem in the short term, you want to think about the factors that have contributed to these veins becoming engorged and inflamed. Okay, so what happened to Eric's thrombosed hemorrhoids 17 years ago, you might be wondering? With a lot of TLC involving sitz baths and donut cushions and a huge glass of psyllium husk powder every morning, which I'm telling you, 17 years later, he still does that every day. Every morning I hear the spoon mixing up in the glass, sort of ding, 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 as he's mixing up his psyllium husk. So with all of that, his thrombosed hemorrhoid did finally resolve after a couple weeks. And I'm happy to report that it has not recurred. There have been occasional glimmers of discomfort here and there, usually involving long car trips or him getting off his fiber game a little bit because of travel, but he knows exactly what to do to get things back on track and to avoid a rectal exam from me, which, believe me, is one of his main goals. So I want to leave you with 3 takeaways about hemorrhoids. Number 1, if you are having rectal bleeding, blood in the stool or blood on the toilet paper or pain in your rectal area, it always needs to be evaluated. This is never something that you should just ignore. And the first part of that evaluation is just a basic rectal exam. It's important that the person who's doing the rectal exam asks you to bear down and sort of push, because that makes it easier to see an internal hemorrhoid, which is higher up in the rectum and may not be visible with them just looking at your rectum. You have to push. It's called a Valsalva maneuver. So sort of like you were trying to pass gas or have a bowel movement, and sometimes you'll see that internal hemorrhoid pop out. If they don't see anything on rectal exam, then a colonoscopy is usually the next step, especially if you are having blood in the stool. Number 2, hemorrhoids are benign conditions, but they can still be super bothersome. And they can almost always be improved or healed completely. So do not just resign yourself to saying, okay, I have this pain in the buttocks area, because there's so much that can be done. And number 3, The treatment approach to hemorrhoids can and should involve getting you immediate relief, particularly if you have something like a thrombosed hemorrhoid. But that treatment approach also needs to address the root cause of why your hemorrhoid formed in the first place. No amount of Preparation H cream is going to help if you don't address your underlying constipation, or the allergy medicine that's drying you out, or the fact that you're taking your phone into the bathroom in the mornings and sitting on the toilet for 45 minutes. So that's it for this episode of the Gut Bliss podcast on pain in the butt hemorrhoids. For additional free resources, go to gutbliss.com and click on the Gut Guides tab, and you will see a gut guide for hemorrhoids. The guides are arranged alphabetically, so they're pretty easy to find. Thank you for letting me get up your butt a little bit today. It is all part of my master plan to make sure that you are experiencing gut bliss in 2025. Coming up next week on the Gut Bliss podcast, 30 different plants per week, the magic number that everyone should know about. Go to gutbliss.com for my free 7-day microbiome reboot course. If you like what you're hearing, drop a review and hit that subscribe button. And remember, dirt, sweat, vegetables, the best prescription for a healthy gut.
The information presented in this show is not meant to be medical advice. Consult your doctor before making any decisions about your health. The patients discussed are real people, but names and identifying features have been changed to protect their privacy.